Has any of the evidence that we've taken so far persuaded you that we should look at some kind of sanction regimes? I think that I think we should remember, you say one of the actions within A Healthier Wales was to introduce a range of levers for change. Would some kind of sanctions system be part of that? Because we do see change happening very slowly in some areas.
I think we need to be really clear about what sanctions people are talking about, because it's quite attractive to say there needs to be a penalty if you don't do something on the one hand, and yet actually to get that into practice in a way that will deliver the sort of change we want to, I think is rather more difficult, because we're looking for people to implement duties around quality and candour that are about a different way of working and behaving and require more openness. The challenge, I think, then is that if you have a pretty straight-line approach to sanction, that you can end up driving people away from that. And rather than being more open, you end up having incentives to try and avoid the sanction, which doesn't necessarily lead to the openness and improvement that we're looking for across the system. So I'm not persuaded that we want a sanctions regime around this. We already have quite a lot of scrutiny around the health service. I know every now and again people like to talk up the fact there's a democratic deficit in the health service, and yet I'm here today answering your questions. I regularly get the opportunity to answer questions in the chamber, which is very good of you. And all of you have relationships with your own local healthcare providers as well. So there's quite a lot of politicians with a very direct interest in the health service, and there's quite a lot of scrutiny that takes place in the way that our health service functions.